So, a lot of Americans know what hospice is, but can you talk about why hospice?
Why hospice is a good idea? Because hospice offers so many benefits that most people don't know about. And hospice is actually more of an umbrella of services that can just help with well being, and it supports the caregiver as well as the person who's dying. So, why hospice? Because it offers things like nursing visits to the home or to the skilled facility or to a comfort care home, wherever the person is. It can include an aide to help with bathing a couple times a week. There's usually a social worker that comes to visit. There could be physical therapy if it's a comfort measure, uh, and a chaplain could come. Sometimes there are volunteers who come and play music or sing. So these kind of benefits actually improve the quality of life, and a person often has better time with their family and might live an extra couple of weeks or a month or longer.
And does pain medication get included as well?
Definitely. Um, yeah, pain medicine, that any medications actually that help keep the person comfortable. So it could be medication for anxiety or agitation as well.
I know that a lot of Americans who are otherwise eligible for hospice care don't receive it. Why is that?
Well, I think it's because people are afraid of death. And just like cancer is that C word, hospice is that H word that people feel like they're just not ready for. It's it requires a lot to come to terms with the fact that you're dying. And often family members aren't ready to let go. Family members want to fight for every week or day they can have with their loved one. So there's a lot of reluctance. People need time to get used to the idea that they're dying.
Sometimes, though, if there is hospice care, it might not happen until just a few days before the actual death. What are the benefits of beginning it earlier?
Right. Well, but basically to get those services in, hospice also includes things like equipment, whether it's a bed or oxygen. And the average stay in hospice is short in America. The average stay is like 10 days to 2 weeks. And most people that qualify for it that do not have a sudden death, I think we have half of Americans just aren't receiving it because they're not ready.